Hello. Welcome to a new video. My hair looks wild.
Hello. How are you guys doing today? My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks. And this is a special one, folks. We have a new Amberlynn Doctor Medicine woman on deck. We have a new diagnosis. So this one is called I Have a Hernia. Spoiler alert, that's the new diagnosis. Glorifying obesity and new gallery wall reveal. You guys know how I roll. I don't care about the gallery wall. I don't care about the P.O. box. I don't care about any of that. And that's why sometimes I fall behind with Amberlynn Reid. But we are caught up and we have a new diagnosis. A hernia. We will get into that. Before we do, guys, don't forget to hit the like button, hit subscribe if you're new. I appreciate that. Leave a comment. Love hearing from you. And let's get into this. Oh, by the way, I do have memberships. If you wish to support the channel further, please feel free to join the K-Jeezers. So let's get into it. First on deck, we do have more of a girlfriend reveal. Yes, she is exposing Feline, Jade, wifey, whatever you want to call her, one extremity at a time, one digit at a time, one arm at a time. Here we go.
It is currently in the stages of peeling, and it looks disgusting. She had this like thing over it for 2 days, got it taken off. And then she had another one over it for 3 days, and I yanked it off of her last night. This is how it's looking. So once it is done healing, we will show you the final. Because right now it's looking... Does that feel good though?
A little bit, yeah.
So do you like it?
I love it. Do you like it?
I love it.
All right, all you heathens that are tatted up, tell me if that is the normal healing process. I don't know. I'm plain. I am unadulterated. So please just let me know if that's normal, because I don't know.
Oh, people, it's been days since I actually vlogged. So, hi, how are you? Today's my 6th therapy. So I've been noticing weird symptoms. I'm very much like, I pay attention to my body, okay? I do. I know a lot of people like to think that I don't, but I'm smart. I feel like I'm Dr. Lynn. I just know things, feel things, sense things. So I noticed lately, like when I lay down flat, my stomach kind of has like a bulge, and I'm just like, what is happening? Like, it doesn't hurt. It's weird. It's something like new. And then, so I was putting like 2 and 2 together, and I was like, okay. So most fat people, a lot of fat people, they get hernias, and I never thought that I would be the one, right? And I recently, like a few months ago, just took a test to see if I had one, and I never got my results back. Like, no one ever.
Okay, let's just stop her right there. So, intuitive Lynn, most people would figure out they have a hernia. It wouldn't be a big surprise to them. So a hernia is a gap in the muscular wall, and what happens is that gap allows contents of your abdomen, if it's in the abdomen, to protrude, to come out, and you could usually feel that. You could see it. We all know Foodie Beauty has a hernia. I think it's actually visible, but if you're feeling around, you could actually feel it. So I don't know, like intuitive Lynn, no. Okay, I guess it's good she didn't ignore it, but not a huge, oh my goodness, I diagnosed myself, something was off. Usually you would be able to feel it if it's an abdominal hernia.
Like called me to like tell me my results, and so I figured, okay, so I guess everything's in the clear, because if something would have showed up, they would have told me. But I don't know, in my heart I was like, something's not right. So I ended up calling to get my results, because I never was told my results. And it turns out I do have a hernia, folks. And the fact that I like knew that before being told that, I'm 32 years old. I don't think I could go to college to be a doctor at this point. But it's like, I feel like in my past life, I was a doctor or a nurse, or I just watch a lot of Grey's Anatomy. So I notice that I make jokes and I make light of things that like truly make me nervous. And I feel like this is also karma because when I was younger, my brother used to pull me. I swear I've told the story before. My brother used to pull me in a red wagon, and he's like a year and a half younger than me. You know, that's like my little brother, and like he was probably like 4, and I'm like 5'6", and I'm like, and I was chunky then, okay, and he's like the skinny little blonde-headed cutie, and I'm like this like chunky big sister. And I would tell him, if you push me in the wagon, I'll push you next. And so he'd always pull me in the wagon, and I would never do it for him. And it was, I want to say like a year later, we found out that he had a hernia and he had to get it removed. So this is my karma. And I literally just found out.
Okay, so you normally don't get a hernia removed, you do get it repaired. They close the gap. There's all sorts of procedures now. There's a mesh procedure I know my dad had done. So getting it removed, not so much, but I'm glad he got it repaired.
Just found out as I'm getting ready to go to my therapy, so that's a whole moment. And can it be fixed in weight loss surgery? So that was like the first question I asked, and they said that sometimes they'll do that and sometimes they won't. So it honestly just depends. But since I got that test done, my hernia has obviously grown because I didn't have like that bulge when I got my appointment. So when I had those tests done. So the fact that I have it now means that it's like growing. And, you know, I know that it's like normal for someone my size to have one because it's almost like abnormal for someone my size not to have one. But it's just kind of like goes to show that like health at every size is so silly.
So whether or not they will go in and repair the hernia while they do the gastric bypass, I have no idea. I have seen episodes of My 600-Pound Life where the hernia actually got in the way of doing the weight loss surgery. So I'm sure the surgeons know what they're going to get into, like when they open her up by the scan she's had done. And yeah, her obesity definitely increased the risk of the hernia because the extra weight and the pressure weakens the muscles. So yeah, you have that increased risk of the gap.
All right, so I'm mid makeup and now I'm crying because I have a hernia. So you guys are getting to see the stages of how I go, like as a person. Like at first it was like, wow, I was right. Love that for me. And now that it like has sunk in and I'm sitting here talking to Feline, who is over there right next to me, I've realized that like food does this. I love that. Food. Like food that is supposed to like make you like survive and live and like be in your happy era. Like, no, it does this as well.
Okay, so we're going to wrap this up with my final thoughts. Just what she said there about food does this, I guess, in a way, but it's her choice to eat the food and maybe not get the therapy to help with her food addiction, her eating disorder, whatever she claims she does or doesn't have now. It's not the food, like, itself. It's not like the food jumped in her mouth and decided to cause all this destruction. And definitely not healthy food at that. So anyways, guys, that's it for me. We have a new diagnosis, a obesity related diagnosis at that. So if you made it this far, I do appreciate you guys. Thank you very much. And we'll follow this story, how it goes with her weight loss surgery, if they will repair the hernia while she is getting the weight loss surgery, if we get that far. Thank you so much and have a good one. Bye.